Hi, I'm Ryan Nutter, founder and principal of Cornerstone Senior Advisors. In this video, we're going to discuss the Medicare Supplement Plan N. What is a Plan N and how does it work with original Medicare? Before we dive into the Plan N, let's talk about original Medicare so we can better understand how a Plan N fits in and works with original Medicare. When we talk original Medicare, Medicare has two parts. We have Part A and Part B. Part A of Medicare is your hospitalization. And all these years you've been working and they're pulling money out of your paycheck for taxes, the portion of your taxes that went to Medicare paid for Part A. So you've already bought it, it's already been paid for. We will never tell anybody Part A of Medicare is free because it was absolutely not free. You absolutely paid for it, but it's already been paid for. Part B of Medicare is everything outside the hospital: primary care doctor, specialist, emergency room, even your outpatient procedures, which we'll get to in a moment. But let's first talk Part A. If you go to the hospital, what can you expect to pay if you only have original Medicare with no supplemental insurance? So if you're admitted to a hospital, you pay this $1,676, you're there for a few days, and you go home. Let's say 2 months later you're back in the hospital. Well, you could end up having to pay that deductible again. You could pay that deductible several times in a year if it's a rough year health-wise for you. If you have a longer stay in the hospital, if you're in there over 60 days, now you have a per-day copay of $419, and if you're in there over 90 days, that doubles to $838. Skilled nursing is also under Part A of Medicare, and skilled nursing is essentially a place to recover. So if you've had a life event, a heart attack, a stroke, if you've had a hip replaced and your doctor says you're stable but you're not quite ready to go home, they oftentimes are going to send you to a skilled nursing facility. This is where you will have registered nurses taking care of you, and you'll have your occupational therapy, speech therapy, physical therapy, things like this until you're ready to go home. Medicare fits the bill for the first 20 days. So you pay nothing for the first 20 days in a skilled nursing facility. If you're in that facility for more than 20 days, now you have a per-day copay of $209.50 that you're paying each day in that skilled nursing facility. So that's a little bit of a summary of your out-of-pocket exposure with Part A of Medicare. Now let's shift gears and talk about Part B. Part B of Medicare, remember Part A you've already paid for. All these years you're paying taxes. The portion of your taxes that went to Medicare paid for Part A. You already bought it. Part B of Medicare does have a premium, which in 2025 is $185 a month. So you're paying $185 a month for Part B of Medicare. If you're not drawing Social Security, they will bill you quarterly for $185. So take that $185 times 3 and you'll get a quarterly bill in the mail. If you are drawing Social Security, then they're just going to deduct this from your Social Security check. They're not going to ask you otherwise. That's just what they are going to do. This $185 premium can go up based on income. So this is the standard premium. Most Medicare beneficiaries are going to be paying the $185 a month. So for some of those high income earners, this can go up. If you're concerned about this premium, just give our office a call. We can walk you through what bracket you may fall into with this premium. Most people will be at this $185 a month. So what's Part B cover and what does it not cover? So outside of the hospital, Part B, it has its own deductible of $257. So this is a separate deductible from your hospital coverage, but also it works differently because it's an annual deductible. You're paying this one time a year. So you pay the first $257. Once that's been paid, well, now Medicare kicks in. They're going to pay 80%. You're going to pay 20%. You go to a primary care doctor, you're paying 20%. A specialist, you're paying 20%. Outpatient procedure, emergency room, you're paying 20%. The biggest issue with Part B of Medicare and these 20% is there is no max out of pocket. So if you had a health condition come up, let's say you have cancer and you're going for chemo radiation for several months, you're going to keep paying these 20% and there's no stop loss. There's no ceiling to your out-of-pocket exposure. So these costs are why people get a Medicare supplement plan. They're also called Medigap policies because these supplements help fill these gaps with Medicare. What the government did is they designed this chart. of 10 Medicare supplement plans. They told all these private insurance companies, if you're going to offer a supplement to Medicare, you can, but it's got to be one of these 10 plans. So these companies can't make up their own supplemental insurance to Medicare. They can decide which of these 10 plans they'd like to offer, and they can decide how much premium they'd like to charge. But coverage-wise, like this Plan N we're going to talk about right now, well, a Plan N is a Plan N is a Plan N. It doesn't matter which company you get that Plan N from, they all have to abide by the government's rules, pay how it was designed to pay, cover how it's designed to cover, but they are all going to charge different premium. So that's something to pay attention to, and we can walk you through all the different companies in your area, who offers a Plan N, what premium do they charge. So Plan N, how does it work with Medicare? When you combine a Plan N with Medicare, if you end up hospitalized, this Plan N is going to pick up right where Medicare leaves off. It's going to fit the bill for all of this. So that hospital deductible, the $1,676, you don't have to worry about that. The Plan N is going to kick in and pay that for you. These per day copays, the Plan N will cover those for you if you're in the hospital for an extended amount of time. Your skilled nursing copay, the Plan N covers that for you. When you combine a Plan N with Medicare, you're essentially just going to receive a statement of benefits paid in the mail. Outside of the hospital, under Part B, you have that $257 deductible. The Plan N does not pay that deductible, so you are going to have to pay the first $257 in a year if you have a Plan N. But remember, it's an annual deductible, so you just pay it one time in a year. Once you've paid that deductible off, then anytime you're seeing a primary care doctor, a specialist, this Plan N, you're going to have a copay. So that copay with the Plan N can't be more than $20. A lot of times it's less, maybe $12 or $15. The most it could be is $20. If you end up in the emergency room, the most it would be is $50. So you have copays with this Plan N. But because of those copays, then you can get these supplemental plans at a lower premium. So these plans are pretty popular because they're lower premium costs than your Plan Fs and your Plan Gs. Surgical services, your outpatient procedures, your durable goods, things like that, they fit the bill 100% on those things. You have a copay with your primary care doctor, your specialist, your emergency room visits. It's still dynamite coverage. One of the things that intimidates people with a Plan N is this Part B excess charge. So what's a Part B excess charge? How does that work? Essentially, if a doctor accepts Medicare, that means they accept the Medicare-approved amount for the services they provide. So basically, Medicare is telling them how much they can charge for their services. Well, that healthcare provider can, if they choose, charge up to 15% more than what Medicare assigns them. And if they charge that 15% excess charge, the Plan N does not cover that for you. You do have to pay that excess charge. So that's an unknown, and that can intimidate people with the Plan N. I will say to this point, the Plan N, this excess charge has not been a big issue with Medicare. 98% of healthcare providers in the U.S. accept assignment. They're not taking advantage of the excess charge. Of the 2% that do charge the excess charge, 55% of those providers are mental health counselors and psychiatrists and things like that. It's not real common. So the Plan N has only gained popularity the last several years. There's more and more Medicare beneficiaries that are looking at the Plan N to help with some of their out-of-pocket costs. If you're curious about the Plan N, if you want to know if all of your providers accept assignment, don't charge this excess charge. If you want to see the premium difference between a G and an N, just give our office a call. We can walk you through all the different companies that are available in your area, what premiums they charge, and we can see if this is a real viable option and something you're really interested in. Also, I want to mention, if you want a free copy of my book, Medicare Made Simple, where we dive into these supplemental plans, the Plan F, Plan G, Plan N, what are Advantage plans? Are they really to your advantage? If you want a hard copy of this book, Medicare Made Simple, you can go to our website, advisemedicare.net, click I'd like a free copy. We'll ship one out to you free of charge, no questions asked. Or if you want to just call our office, 316-260-3331, request a copy. We'll get one sent out to you right away. I hope this video was helpful for you. Medicare can feel very daunting. We want to make Medicare feel simple for you. If you have further questions, let us know. If we could be a benefit, let us know. I hope this video was a blessing, and thanks for watching.